chasing the easy life. We're chasing the easy life.
Hi, my name is Jennifer. Welcome back to my channel, the CRPS Network. Today I'm going to be talking about ketamine infusions. So what is ketamine? Ketamine is primarily a medication used to start and maintain anesthesia. It was first approved for use in the United States in 1970 and was used a lot through the Vietnam War. It's commonly used in ERs and in surgeries. It's one of the safest drugs. In fact, the World Health Organization has named it as one of its essential drugs that every country should have. Ketamine helps with CRPS by blocking NMDA receptors. NMDA receptors are activated when you have CRPS. When the NMDA receptors are activated, the nervous system is more sensitive to pain and less sensitive to opiates. There are a few different ways that you can use ketamine. One is with oral use or in a capsule or a pill. This usually will have to be made by a compound pharmacy, and this is not the most ideal method of utilizing ketamine because of the absorption rate the digestive system goes through. You just aren't getting a great amount of quantity of the benefits for the amount of side effects you may have. You may have unpredictable results or find that it just doesn't seem as effective. The alternate methods are through a sublingual or under the tongue or in the cheek method that sort of bypasses the digestive system, and that is sometimes used but shouldn't be used on an ongoing basis, maybe just for a flare-up or something. But the most ideal method is through ketamine IV or ketamine infusions. This is the preferred method and should be done more as a first line of defense. The experts agree that this no longer is something that should be done after you've tried a lot of other things. This should be something that you should try one of the first things if you can. 80 to 85% of patients respond well to ketamine. Okay, if you want to try ketamine before getting a ketamine infusion, you could always try the pills, oral pills, or the sublingual, just to get an idea of how you respond. If you do the sublingual and you're throwing up after an hour, then you may not be able to tolerate the ketamine infusions. However, if you try the oral pills or the sublingual and you get even a little bit of relief and you seem to tolerate it, then it might be good for you to try the infusions. Okay, there are inpatient and outpatient protocols. It just depends on where you're getting your infusion and what that doctor prefers. But the inpatient usually are over the course of about a week, 5 days to a week, where you're there 24 hours a day and getting infused 24 hours a day for that time. They increase the dosage over those days. The outpatient is usually done over about a 10-day period, over 2 weeks, and you go in each day for 4 hours and get infused somewhere between 4 and 5 hours. They start out with a low dose and gradually build up over the 10 days to a much higher dose, and this is called your loading dose. Your initial ketamine infusion is what's called a loading dose. After that, then you'll return for what's called boosters, and ideally you'll want to go about 2 weeks after your first loading dose to have your ketamine boosters, and this is done usually for 4 hours a day for 2 days, and then after that you can go for a day or two every 4 to 8 weeks, just depending on the severity. So everybody is going to be different. Every doctor's protocol is going to be a little different. So just depending on where you go, that may vary. Now, patients are fully monitored by a trained nurse that has been trained about ketamine infusions and some of the possible side effects. They are in the room the entire time during the infusion. Once you start the infusions, you may notice some side effects. They're normally short-lived and can be counteracted with medications. For example, you may experience some nausea, vomiting, some headaches. You could have some colorful dreams, and sometimes in the higher doses, you may even have some hallucinations. So that can be counteracted by taking Versed or Zofran, magnesium. Your doctor may have some other medications, some clonidine, depending on what your blood pressure is. So your nurse will go through all of that with you, and as they're monitoring you, if they notice that you're having some issues, they can administer other medications to make you comfortable during the infusion. Usually you'll go in, like the room will be dark, the lights will be dim. They like for there not to be a whole lot of commotion or distraction. There usually isn't extra people that are in the room. It's just the patient and the nurse, or sometimes a couple of patients in a room. But they like to keep the environment very subdued, and that's just to help you during the ketamine infusion sort of be able to relax. The more you're able to relax, the better that the infusion is going to work. Sometimes going into an infusion stressed out or with a lot of anxiety can cause you to not have a very effective ketamine infusion, and sometimes it can almost make things worse. So making sure that you're very relaxed and calm going into your infusion, stay that way during your infusion. A lot of people like to bring a blanket or pillow from home and some headphones. A lot of people listen to music, relaxing music, or something that will help them relax, maybe some guided meditation. But just bringing things that are comfortable for you or make your infusion more comfortable, that's gonna give you a better chance of having a successful infusion. Okay, if you find the infusions work and you're having success with them, you may consider getting a chest port. And what that is a device that's usually put in the chest and connect directly to a vein that goes to the heart. And this just makes it much easier for them to access your veins when they're ready to do an infusion. Another tip that I have as well is I would recommend asking your doctor for EMLA cream, which is a lidocaine prednisolone cream. And what you'll do is just put that on about 2 hours before on your chest port, or maybe in the area that you're going to have an IV placed. And this helps numb the area so that when they do access it, you don't feel a thing. And I'm not even sure why this isn't mandatory for CRPS patients that have any sort of needle poke, because it really helps just not feel that. And I think the less you feel with CRPS, the less chance you have at spreading. Okay, ketamine can be administered at numerous places across the country. and they do take Medicare at multiple places that I know of. So typically, if Medicare is accepted, a lot of other insurances follow suit. So you may be surprised to find out that your insurance may end up covering to get ketamine infusions. Even if you have to travel, it may be worth it if you are able to get relief. So anyways, I am going to be going for a ketamine infusion, so I would like to take you along with me to kind of show you what the whole process is, and so you could see it for yourself.
Chasing the easy life, easy life.
I'm going for a ketamine infusion. Okay. First, I've got my blood pressure cuff on, and my nurse is going to take a baseline blood pressure and my heart rate.
Thing right here is to monitor the oxygen.
Okay, so we're going to get my port started, and first I'm going to take off this bandage that I put on a couple hours ago that keeps my port access area numb. Okay, now first I have to get my face mask on.
I hear you. I'm just excited, and my roommate, she does documentation on Facebook.
Yeah, so this is a
Saw
sterile
this
process, right? Sterile gloves, sterile everything. Then you have the needle that's going to be prepped as well.
So I've been here about 2 hours, and my eyes are all big. I'm feeling a little woozy. They gave me the first set, and I moved up to my
It's like a preview of what
I have
what's going to happen. Okay, and then the chlorhexidine is going to clean.
She's documenting over there on YouTube and Facebook. She recommends.
This one just the crutch, so then we can put it on you later. Okay, you're ready to lean back.
So, just trying to document what's
Hold down your
I
nose
feel
a
a
little
little
more.
like
Yep, perfect.
my mouth is dry. And I need like my sister to give me my water. My pick ones, I can feel it, it's painful. I'm not
Just gonna take a
concentrating
quick
on the burn wounds on my back as much. They were so sore I couldn't even like sit in a car, or it was so hard. But so I'm in a woozy
Okay, same thing. I'm going to count to 3, and then I'm going to go.
Okay.
Okay. Not to catch up for now. Day
Oh,
one.
it's still not dry yet. I'm sure it's nice and dry.
Kind of.
Usually the port access, I gotta hold it very still. Count 1, 2, 3. How did that feel?
Didn't feel a thing.
Okay.
That's great.
Okay, so then it flushes very well, and then pulling back, and you can have see your blood pull back. You can see a little bit, so that means it's good. So because we need to draw your blood, so I'm just gonna leave the syringe in there and secure it with this clear plastic over here. And then usually if you see in the hospital, they put a little bio patch there for anti-infection, but then, you know, you're coming in for 2 days, so then that's why that one is like the way it is. There it is. We'll just have to read.
It's not going to be fun taking that off that sunburn.
Oh, I know, right?
There's no other choice, yeah.
Okay.
Totally my fault.
So then with the blood draw process, since I flushed it, so I have to pull back and waste a little bit of blood. You can see, so we want a good value and not a diluted blood. So we'll just waste a little bit.
Blood's taken, what do they check for that?
So
Pregnancy?
the pregnancy test and then the CMP, which is a complete metabolic test that checks the sodium, potassium, glucose. It has your kidney value in there as well. Another specific test is called LD. It's lactate dehydrogenase, which checks your a part of your liver enzyme, and then the ketamine do have some effect on your liver metabolize the ketamine. So that's how we check the LD, the lactate dehydrogenase. Then we flushed it. There we go.
We couldn't chit chat while I'm laying in bed. Kind of. Oh, surprise.
And then after that, we get hooked up by this IV line right over here. Okay, that's it.
Great. Ready to go. I can take off my mask now.
Yeah.
Usually you'll get some pre-meds, maybe some Versed, possibly some clonidine, depending on your heart rate.
More of the blood pressure.
Or blood pressure, not heart rate, blood pressure, sorry. And also I get some Zofran to help with nausea. I get extremely nauseated. And today I'll be getting something for a headache, which isn't a normal, but I have a headache going into it. So sometimes ketamine can give me a headache. So I'm gonna just combat that before I start. So here are the meds that I'll be getting.
Zofran, Toradol, Versed, and the clonidine.
I bring some Serenity essential oil. Yeah, I bring, and I have my headphones. Yeah, I bring headphones and play music. Okay, my clonidine.
Okay.
All other meds will be through IV. Get my headphones. Get my music ready, my phone. Got it plugged into my charger so it doesn't die during my infusion.
Am I dying over here or something?
Sterilize the access.
In a while, crocodile.
Okay, I'm gonna give you a Toradol first.
Okay. have my phone set on calm, relaxing music. Relaxing spa music.
This is the Zofran.
So this girlfriend. This helps with nausea.
Okay, I'll give the Versa when you're
Okay.
ready to set up.
I'm ready. I'm done with my infusion and feeling a bit groggy, but okay. And I just got my cord disconnected. They will leave this in for the night because I come back tomorrow for another one. And Molly, the helper, service dog, she's still here doing her job.